Hello, my name is Jose Castillo. I'm gonna be doing the diabetes management procedure validation. So the first thing we do is we verify the order. So we check that the provider has ordered 10 units of regular insulin for the patient and also 10 units of NPH insulin for the patient, a total of 20 units of insulin. The next thing we do is we assess for the procedure need, meaning we need to make sure that the actual patient that we're going to see is the one that needs the insulin. Once we confirm that, we'll go to the following steps. So we'll walk into the patient's room, we'll perform hand hygiene, we'll wash our hands, and we'll don gloves, we'll introduce ourselves. We'll provide the patient with privacy. The next thing we do is we check on the patient's wristband for his identification. Usually what we do is we ask for his name and a date of birth. It's a good moment to do some patient teaching and some patient education. So I'm gonna tell him he's gonna feel a slight pinch when I use the glucometer in order to measure his blood glucose. Also, I'm gonna tell him about some of the signs of hypoglycemia, like dizziness, cold. He could feel clammy or confused. Also, I'm going to tell him that it's part of his responsibility to check on his own blood glucose readings, his own monitoring, because he needs to learn how to interpret his readings and respond to his own results. I'm going to provide the patient. I'm going to make sure like the body mechanics are good, that he is laying in bed, that he's comfortable. Also that everything that I need, the equipment is in place and the patient is safe. The bed rails are up, the wheels are locked, and everything is good. In order to prepare the glucose monitor, the first thing we do is we're gonna just clean the patient's fingertip with an antiseptic and let it dry. So after we do that, we release the lancet to pierce the skin. So the first drop of blood we're gonna discard, we're gonna take away, and we're gonna use the second one for the reading. So we're gonna put the strip right next to the blood, remove the lancet, throw it into a sharps container, and that second drop is the one that's gonna give us the reading. Next thing we do is we're gonna be verifying the provider's prescription, which we had done before. This is gonna be the second time we do it. The provider had prescribed, his order was 10 units of regular insulin and 10 units of NPH insulin. We verify the patient, medication, the dosage, route time, and indication. The next thing we do is we check the vials. So we have an NPH vial right here, and a regular insulin vial marked with an R. So once we confirm those, we check for expiration date. For the regular is fine, NPH is fine. Then we clean both of the vials, the tops, with an alcohol swab, and we let it dry. Then what we do is we're gonna use our syringe, prepare it. We're gonna draw 10 units of air and put it into the NPH. We remove the syringe. We're gonna draw again 10 units of air and we're gonna put it into the regular insulin. But now what we're gonna do is we're actually gonna draw 10 units of regular insulin, and then we will draw 10 units of NPH. Once we're ready, we'll prepare the needle for the patient. We have to administer the medication within 5 minutes of mixing it together to make sure the effectiveness of the medication. We access the patient's MAR, and right before we give the patient the medication, we have to do a third check. So what we do is once we enter the patient's room, we compare the prescribed medication with what appears on the MAR. So we need to make sure we have the right patient, the right drug, the right dose, the right route, and the right time. We make sure that the needle size is correct. Then what we do is we're gonna choose a patient site. In this case, this is gonna represent the patient's abdomen. We're gonna clean it, we're gonna allow it to dry, and we're going to inject the medication. The patient is regular sized, so we're gonna do it in a 45-degree angle. We administer the medication quickly, and then we're gonna place it into the sharp. We're gonna throw it in the sharps container. The next things are the documentation as per facility policy. So we make sure that the patient health status is correct, specific to diabetes, which is what we just treated the patient for. So the patient received his insulin well. We did make sure that the patient had something to eat within 15 minutes of injecting him, so that the insulin goes to blood work right away. We also have to document the blood glucose measurements. In this case, it was 301. His blood pressure was 120/80. His pulse oximetry was at 98, respiration rate of 16, and the patient had no pain whatsoever. The current treatment of the patient is using NPH from home every day. And again, what we administered when we documented is we gave the patient 10 units of regular insulin and 10 units of NPH insulin. That's what was administered to the patient.